much. What an honor to be here, and this is so exciting. The level of intensity of the discussions last night was profound. I just maybe start out just by thanking you so much for having me here, and also just the way that you have had me here. You know, it's super fashionable, you know, to be engaged with patients and all of that sort of stuff. But there are a lot of different ways in which we as patients kind of feel like you really want our opinions and you want us to be part of what you're doing. And this has been off the charts. Your experience in trying to understand what we with people with diabetes think. And I love it that you didn't say, oh, we just want you to bring the patient perspective. I mean, the patient perspective, like there's, you know, in this chronic disease and in most diseases that you're working on. Of course, we know that these diseases are so heterogeneous. There are so many different kinds of patients, and so inviting me into the discussions really early has been awesome. Also, just seeing how incredibly committed BrightInsight just is to making change is awesome. I do think diabetes is an amazing case study, so I hope that there are lessons here that apply to everything that you're doing. And it is also a plea. I mean, all of the ecosystem approach that we've been hearing about this morning, this is absolutely critical. In diabetes in particular, you know, $1.3 trillion was spent on diabetes last year, and like for that amount of money, it's not even going well. You know, this is not CRISPR, you know, this is not immuno-oncology. But that makes it like a great, it just is a great opportunity. There is so much to gain in our area in particular. So I say that, let's see. So these are kind of the three segments that my talk is going to go through. I also just wanted to say, you know, I guess like raise your hand. I didn't figure out the cool polling thing beforehand, but raise your hand. You know, do you know someone with diabetes? Yes, everyone. Do you guys raise your hand if you consider yourself close to someone with diabetes? Keep your hands raised if you feel like you understand their lives well. Yeah, so I'm going to zip through the beginning of it, and it's just to say I know that a lot of us kind of feel like we know people with diabetes well, but like we hide stuff all the time. There's so many different vulnerabilities. I mean, first of all, the fact that diabetes is affecting disproportionately people that are underserved, like this is who we need to be helping just as a moral imperative, one. And then two, again, diabetes is relevant to almost every single other disease state that is out there that needs help, and everyone can benefit from an ecosystem approach. So if you're really interested in understanding more about the ecosystem approach and you might be open to this, we're actually having an event in San Francisco on June 4th and 5th, right before the scientific sessions start there. We spent a whole year working on what is the ecosystem in diabetes. We think like we don't even necessarily get it. And silo is just a way of life, I think, for our field. And I love it that you're really trying to change that. And I do really hope that we all can summon the right investments to make that happen, because there is absolutely kind of a sense of scarcity in our environment. Like everybody wants to partner and everybody wants to collaborate, but actually having the capacity to figure out like where you can be a leader. I mean, a leader would be great, but even where you can be a supporter, there's much more enthusiasm for being supporters than there actually is action about being supporters. So you can read about this event if you want. I mean, it's actually completely booked out, but this crowd is amazing. So if there's interest, you can look at diatribe.org/D19. So I'll just start by kind of racing through some of this stuff. You know, it's a roller coaster, and this is you know, we want to act like we're doing really well. But very few of us with diabetes really have it together. 80% of people with type 1 are not at their glycemic targets. 45% of people with type 2 are not at their glycemic targets. And we really feel very isolated, right? So much of this is just a total tightrope. Maybe it's not so surprising to look at some of these numbers and to guess that this is a pretty isolating disease. Again, we know, of course, that this is affecting so many people who don't have any resources, financial resources, also community resources. And I think this group, like you probably hear about some amazing, amazing therapies and technologies, and I just have to say, like the science in diabetes has been amazing, right? What the science has shown is incredible, and there are all kinds of individuals that have done much better. But we are totally failing our communities, you guys, and like this is where really an ecosystem approach could help so incredibly much. So like the science and the technology, I kind of feel like that's the hardest stuff. And it's the barriers around this, absolutely starting with systems, moving on to prevention, and especially prevention of complications. There's so many funds that could be saved, that could be going elsewhere. Thinking about behavior change and behavior design is another barrier kind of area of investment. And the last kind of group is really thinking about how to affect stigma and how to affect social change and public attitudes. And again, like, you know, what digital ecosystems have the power to do here are really huge. This data comes from DQ&A. I co-founded DQ&A back in 2009. This is a patient panel of about 18,000 patients across North America and Europe. We ask them, this panel, different things every month. Every quarter, there is a survey that goes out, and then we do a lot of custom work as well. And so really understanding patients better is everything that we are about. I think a tricky thing is, people say all the time, just let's do what the patients want. Just ask the patients. I mean, like, yes, like I want you to ask what patients want, but I also want all of us to be able to help us patients get to a point where we all are really focused on improving outcomes. And a lot of the outcomes that we can improve, like that might not be actually my first priority as a patient until I really understand it, right? But some of the medicines that have been invented in the last few years, like they now prevent heart attacks, they prevent strokes. There was data announced in Melbourne last month about preventing kidney disease. You know, when I saw this data, I have 3 preteens and teenagers, and I just went into their bedroom and just cried, like for all of the patients that could be helped by preventing kidney disease. And I mean, these are kind of the people that like the rest of the world wants to forget about, you know? I mean, it's like Medicare is the one that like takes care of dialysis and all of that. I'm so psyched that there is a really bigger focus on insulin affordability, and I really salute all of the manufacturers who are making insulin, like they get it, we're in, you know, we do want to change this. It's complicated. I also would love for some of us to think about, like, what's going on with dialysis? Like, where's the spending on dialysis gone over the last 30 years? And I don't mean, like, we all know it's gone up, but like per person, what has happened? And what could change that? I mean, this is like the center of things I think that could change with digital health. So this one's also interesting. You know, like emotional well-being is so important, you guys, and it's so important to all of the patients out there. But actually changing emotional well-being, it's not like, okay, done, you know, it's not going to be like just about an app. It's going to be, again, like some of the work that BrightInsight is doing. It's like helping patients really feel heard and helping like pretty diverse groups of populations feel heard. So, we don't have all of the time, obviously, to go through this data. If you're interested in it, just let me know. We can also easily post these. But these are the pieces. If we just think about $1.3 trillion, I mean, $600 billion of that is productivity. You know, and I kind of feel like I have these conversations with people like, oh yeah, like the productivity part. You know, like, no, like the productivity part. And we have to make employers see the power of what is here. I think there is, you know, so much to this. So this is actually just a little experiment I'm going to try. So these are literally my numbers, like kind of right now. So I was in Raleigh the other day, and I have a closed loop system. It's pretty amazing. I'm going to show you how it works. This is just a piece of it. but I was in Raleigh at the airport, and the closed loop system actually, they made me check my luggage, and I needed a new pump, and I had just forgotten to grab it. So I'm like, I'm here for 2 hours. I need to take an insulin shot. Where's the Walgreens? You know, and the security guard was like, oh my God, like, all you need is a syringe? And I was like, yeah. And he said, oh, I have tons of syringes. Like, people with diabetes all day long, you know, mess up. And so he gave me a syringe. So I'm going to show you, like, the different things. Like, this is kind of what 99.9% of the world with diabetes is doing. Maybe if you're lucky, and thank you, Novo Nordisk and Lilly and Sanofi for making pens. The pens are incredible, but not everybody has them. And then, like, that's how you could take insulin, and you would totally have to guess. In 5 years, I really hope that we are looking back at insulin dosing and being, like, incredulous that we did this manually, right? So I don't have too much time, but I'm going to try to do this so that you guys see it. The cool thing is, like, on insulin delivery, like, this is what an ecosystem approach is showing. You can see how it's 0? Like, for the last 2 hours, I actually needed less insulin than I had taken. So my closed loop system that is enabled by my Riley link, I guess it's back at the at my table. But if someone wants to actually look at the last table, if you can see a little black bag, I can even, like, maybe. That's a cool purse, but it's actually the other one. Is there a little Riley link there? It doesn't matter too much if there's not. I think that it's actually cool that is the signal coming? Yes, exactly. So what I'm doing is it's saying, you see this little red, you see the red thing, it's saying replace pod. Thank you. This is so cool. It's saying to replace the pod. And so I'm gonna wait for the I'm gonna actually wait for the signal to come back and do this at the very end. But it's just kind of an example of like we're reducing friction by creating these ecosystems. We're making it way easier. You know, like, this is how the rest of the world is doing this, and by making ecosystems, people can do so much better. And there's so many different things. You can look at this diatribe.org/42 factors. So many things make diabetes more complicated, right? These are just some examples of thinking about food, all of the different things we need to think about how to do better as patients. You know, people ask, and again, like, insulin affordability is so incredibly important. This is a human right. Everybody deserves insulin, but, like, there's no conversations in Washington right now about how should we be dosing insulin. How do we figure out how many more people need to go on insulin? Cal and I were talking last night about he is so brilliant. We were talking about, you know, some work in other therapeutic areas where there was just more focus on, so how many people should even be taking this? I mean, we know the systems are not set up for primary care doctors to even encourage people to be on insulin. And so we just kind of did math, the back of the envelope, you know, and figured out literally, like, the insulin market would probably expand by 10 to 20% easily if we could just, you know, add a small number of people who would benefit from insulin but are not taking it because of other barriers in the system, right? And we know that this is true across the landscape for other medicines. There was some reference this morning even to, like, patients, insulin requiring patients. I mean, right now, way more people require it or would benefit from it than are taking it. And this is public health. There's so much room to improve here, right? So I'm going to just talk a little bit about this was a part of a conversation that we had last year at ADA. My colleague Adam Brown is so brilliant in how he thinks about diabetes technology, but, you know, all about really having less friction on every single part of the system and just on having more decision support. I gotta say, I mean, it is really upsetting to know it's not really about were they replacing doctors, all that stuff. Like, you guys, like, people don't even want to become diabetes doctors anymore. There are major, incredibly highly respected residency programs that are just not even filling up, you know? And I mean, I wish that we could be like dermatology and have 800 applicants for like 4 spots, but, you know, like, we can't even fill the 4 spots in some of these programs. And so this is really, really upsetting. And this is, I think the promise is what could happen, you know, if people were kind of open to you know, technology being a much better enabler of insulin dosing, as an example. Also, if there was sort of more focus on what are the patterns, what is happening. I think people with diabetes most of the time just feel like it's my fault. And you know, there are lots of pieces of diabetes that people could be encouraged to do differently. And I think if people felt very supported, that would be amazing. And the level of support that we can see from some of these apps is pretty amazing. Also, the idea of coaching and the coaches being enabled by the data, having just my diabetes looked at in a way, I'm just going to be fact-based and data-driven, and it's not going to be about, you know, making people feel bad, but making people feel you know, really enabled. And I am super psyched about where some of these pieces are going with insulin dosing, and I'm really hoping that it can help healthcare providers hugely. I love the work that is being done on smart pens, and again, like, it's so cool, BrightInsight and Novo Nordisk working together, and I also love it. Like, this has been worked on in Sweden for a little while, and I think we're impatient as patients a lot of the time, and I think it's really important for us to know, no, like, it's actually probably better to, you know, for you guys to get it right in smaller groups, and then be able to come out. I think we're impatient as patients, and that's not necessarily always a great thing. This is what I'm going to go back to at the end when, let's see, yeah. So I'm going to see if this is if I can show this to you guys. All of the work on apps. Obviously, there are so many different apps. There are a lot of ones that patients like more. I think, again, making things easy is really important. And I think also the message probably does need to come to patients. Some of the stuff might be clunky at the beginning. And if maybe everyone acknowledged that and asked for help. I mean, the first CGM, I was just rereading some things that we wrote at diaTribe.org about the first CGM, Dexcom's first version of the STS. And we were like, this is so amazing. Like, the reliability is not good, and like, it's not that accurate, but we get to see all our data all the time. And look at what has happened in Dexcom, working with the rest of the FDA, like, very closely. But it's been a lot of incremental moves. And today, where it is incredible. And today, the biggest problem is just getting it to more people. And if we can get the volume up and the costs continue to be lower, and if we can get, you know, Medicare to think about giving it to people, not just people on insulin, but everyone to sort of have a chance to co-produce their health. That's a term from Vivian Lee at Google. And really having patients be immersed and getting it, again, not the patient perspective, but what patients particularly need when you risk stratify us. And you know, I think that there is a lot that can be done on that front. This just the piece about, you know, connectivity is good, but it is the connection, and, you know, being able to encourage patients to do peer support, working with each other, and we probably will want to see the system change, the healthcare providers of the future relying way more on nurses and social workers and getting them on board with what you've got, which I have to say, there is so much enthusiasm about that. And when we talk about digital health, the most enthusiasm has been, Chris Borgstrom is here. I mean, he has worked so much with groups like the best and brightest doctors, and also all of the nurse practitioners and social workers and all of that. And he has been, like, pushing this field, making it into a movement for many years. And I would just really encourage, you know, even more of that, the connection with people and taking time to understand that they need to have some time to talk to each other and to and to listen to all of the things that are not going as well as they could. We like it that design is such a buzzword in healthcare now, and we would encourage way more of this. Dennis Boyle was one of the co-founders of IDEO. He's been on our board at diaTribe a couple of years, and all of the work that he is doing to help us. If you look at Eli Lilly with Trulicity, Trulicity is a GLP-1. This is off the charts. GLP-1 is also an area led by Novo Nordisk, and Sanofi is getting into this. This is an much easier drug to use than insulin, and a lot of it has been helped by not just the molecule, but the applications. And cheers to Lilly in particular for working with a design firm and making these investments in this. You can go back to this. This is just like some tips for working with patients. This is a little bit about diaTribe. We send out a newsletter. It's almost at 200,000 now patients every week. We write to 10,000 healthcare leaders and their teams every day at Close Concerns. And so thank you to many of you in the audience that support us with that. We go to about 50 scientific conferences every year. We follow about 50 different companies that have their hands in and around diabetes, and we are just watching to see who else from the ecosystem can be impacting this disease. We could call this a success, the impact on digital health for diabetes. There is so much to gain in so many different ways, right? So, and I think a lot of the successes that I love seeing in digital health, it's taking advantage of molecules, and then it is also saying that there are other things that really matter too. So food and mindset and sleep and exercise. This is a book that was written by Adam Brown last year. It's now sold over 150,000 copies now, I think. It's on Amazon for $5.80. You can do a free download. And we hugely support hugely appreciative for the support that the field has given us in spreading the word on getting beyond just A1C and getting beyond just the traditional thoughts about medicine, especially because we all want to address adherence. I'm not even going to say solve. Let's just address it, right, and have it be better than 50%. There's no way that this is going to happen if patients don't have more help on mindset and on food and so forth. So, there's a laundry list of things that probably have to happen before digital can have its biggest impact. But, and this is just a sweet picture of our team. We're powered by people under 30. But just to go back and say, the chances that you have in digital health to make an amazing, amazing impact, on this field are absolutely huge. You know all the numbers. Everybody in the U.S. approaching everyone has access to a smartphone. But still, the uptake to apps, it's pretty low. And again, I think we're in this iPhone culture. We all want things to be pretty and shiny, and it doesn't work like that in areas that need to be regulated. And I think we should also all be saluting FDA and the work that they're doing, and to recognize that they're pretty under-resourced, But we are really hopeful about more and more apps and better ecosystems coming to patients that kind of meet the threshold for this radical convenience, frictionless, compelling decision support for a majority of patients. So we really do need more elegant solutions, but you guys can do this. And there should be so much motivation within your companies to work on this. And if they're not, you can use diabetes as a case study for where things can be, improved. I also just wanted to just say that, I think there's a moral imperative as well with diabetes, and there's so much to be gained. And we look at examples like Robert Smith. I was at the Milken Global Conference a couple of weeks ago, hearing him talk to Michael Milken. This is somebody who is way disproportionately going out of his way to help people where the ripple effects are going to be profound. And there are so many examples in public health where you can make a difference. I know you guys are already doing this, and I just salute all of you and thank you for doing it. Getting us out of silos is so important. Having us recognize that the silos are all about capacity, so we do need to have more investment in partnerships and make sure that people actually have time to do it. I guess the last thing that I wanted to get at is, the wind is blowing a different way right now, right? And I'm actually not sure that everybody is going to get to keep the net margins that they have without being able to show more impact. And I know that there are so many people in the biggest companies out there who are working incredibly hard. And like the media could not be worse. I think it's really important to recognize all of the favorable things that are happening and the positive things that are happening and the intent. And I really hope that you all focus even more on building ecosystems of choice. Again, if you're interested in doing this with diaTribe, check out diatribe.org/D19. And thank you so much to BrightInsight.
Terrific, terrific, terrific. Let me get the